Should just be a minute or two, if that. It's ready when you are.
Okay, good morning everybody, and welcome to the governing body meeting for the Vale of York CCG for the 7th of January. It's a new year, and we're in the same place, unfortunately, and lots going on that we'll probably hear about today with regards to the next COVID wave and the pandemic response that is happening around this area and nationally. We have no apologies for absence today. And I just want to ask if anybody's got any declarations of interest that come up in the business of the meeting, please let me know as we go along. The minutes of the meeting were held on the last ones were held on the 5th of November. And has anybody got anything that they need to clarify or talk about around those, or otherwise can I say that those are approved? Yeah. That's fine. Thank you very much. So I will virtually sign those off and look at those and sign those off with Michelle. The matters arising from the meeting, I have looked at these, and from my mind, a lot of these things will get picked up during the meeting today, and some things have also been picked up or getting picked up. So I know, Denise, there was something around calls to be arranged with TUV regarding local concerns around mental health, and that's something that's in hand. And also we're talking about North Yorkshire County Council Health Child Service that was going to be circulated to primary care, and access for mass flu vaccination initiative. So I think those type of things will probably be brought up maybe in the body of this meeting, and if not, we'll make sure that those are brought up and acted on, if that's okay. Has anybody got anything else that they wanted to talk about the actions? And I know that the update on work relating with physical health checks for severe mental illness and with learning disabilities is also ongoing, so I'll keep close to that if that's okay. Yeah, great, thank you. Okay, so I'm just flicking back up my agenda so I know where we're at. So that's the matters arising from the last minutes. So that means we'll go straight over to Phil for the accountable officer update.
Thank you, Nigel, and good morning, everybody. So my usual update, I'll reference the main themes in the report and just provide a brief comment to each of those main headings, starting with the financials. So as recorded in the report, a broadly positive and relatively low risk position compared to where we've been. We'll hear more from Simon Bell about that later, but you'll see in the report that it's enabled us to make some positive moves supporting LD health checks and positive moves in terms of supporting adult autism and ADHD services. So as in previous governing body meetings, this financial year, a broadly positive and low risk picture. Any questions or comments on that? I'd appreciate it if we could pick them up during Simon's report later. Excuse me. From a service recovery and restoration perspective, it's a pretty fluid position that we've got at the moment, significantly impacted by wave 3 and the variant. We have, over the last period since we've met as a governing body, continued to plan for recovery. Those plans are now subject to significant revision, and we're in a period where, from an acute perspective in particular, our conversations across the ICS are about mutual support, with a focus on hospital services in particular. We're probably going to have to say we'll take stock again in the springtime around recovery and restoration when we are through this particularly challenging period. Within the ICS, the pressures at the moment on hospital services are being felt mostly in Hull, but the community case rate that we are seeing in and across York, which is now the highest in Yorkshire and Humber, suggests that the pressures in York will start to build and peak in 2 to 3 weeks, and therefore we will have an even more challenging situation within the ICS in terms of offering mutual support, but in particular for our own hospital services. We'll hear more later as well about progress with the vaccine and primary care. Colleagues on the involved in this meeting will know that it has been and continues to be busy in general practice, and we don't see a particular end to that at the moment, but there are discussions at a national level that hopefully will help in terms of the prioritization of work in general practice and primary care. And I'll leave it there in terms of recovery and restoration, because it is so fluid at the moment, and many colleagues involved will be nearer to some of those patient services than I am. If I move on to the Better Care Fund, so the Better Care Fund will continue into next year, which is worthy of note from a governance perspective. And next year, we're hoping to do something different and better with it. To be able to do that, we need to work more closely with partners, and I'll come to that in a moment, because that's linked into the governance issues, which are the next part of this report, which references the national consultation around establishing integrated care systems with potential statutory powers. That consultation closes and finishes this week. We anticipate that there will be legislation that is passed that enables that to stand up from April of this calendar year. That includes the proposal to disestablish all CCGs by no later than April 22. In the knowledge of that, we are now thinking about and working with North Yorkshire CCG to manage the transition together and see what opportunities that might create for us. More to follow on that in our next public meeting, and in particular how we then try and focus on our communities and places in York, in Rydale and in Selby and the surrounding area. And that is where we start to think about the Better Care Fund and how we might make more value from that in terms of patient services at a local level. So more to follow in governance terms, and we will probably need to spend a fair bit of time on that when we next meet in public. Just a brief reference on EU exit. So it looks like that's going to be less of an issue than we anticipated. Any issues that do present either about supply chain or workforce will escalate up to governing body on a as and when basis. And then finally, just to finish, Nigel, with the letter appended to the report, which confirms the lifting of legal directions for the CCG. From a statutory perspective, that is a significant and important milestone. I'd just like to say thank you to all of the governing body members for helping us to achieve that. And thank you to all of the Vale of York staff, previous and current, for helping us to do that. It is a really significant moment for the CCG, and one that we should really note and celebrate. I'll stop there. Nigel, thank you. Happy to take any comments or questions.
Great, thanks, Phil. And I completely echo and support your thanks for everybody that's helped us with that last bit about legal directions. Thank you. Anybody got any comments or anything that they would like to raise at this point? Helena.
I just want to ask, what's the position with better care funding and the North Yorkshire, the Vale area, the equivalent?
Same thing, I think, Helena. Same thing. In principle, I see no reason to look at it any differently. The way that North Yorkshire County Council have previously managed the Better Care Fund has always been one where they've looked for opportunities, but their focus has been spread across what was a much larger number of CCGs, so it didn't enable them to particularly focus down on communities. I think with them only having 2 CCGs to talk to now, it gives us an opportunity to move that discussion. And any ideas or suggestions that you've got in that respect, or if you want to be involved, then I think we'd really welcome that. But in principle, exactly the same.
David, did you want to come in? You're on mute, David. Can't hear you, David. I think you're on mute still.
Is that better?
That's
Great.
Yay. Yeah, thanks. Yeah, I mean, the good news about adult autism and mental health services, additional funding is very welcome. But, you know, I just wonder, and it's something that we'll probably return to, but, you know, children's mental health services in particular, you know, ADHD and autism services, I mean, you know, they're going to need additional resources. Are there plans, any thoughts about what we can do for children?
Andrew, would you mind if we invite Denise to comment? Thank you.
Yeah, Denise, can you come in on that?
I can. Of course, David's absolutely right. The challenge for children for autism and children's mental health, we knew it was a challenge before the pandemic, and increasingly that's growing. It's positive in that CHUV have already started to put additional funding that they've had in terms of slippage into children's services to address that. The impact of that as yet, we're not sure. I can't model it at this point, David, but there is additional resource going into that in recognition of the challenges that we're facing.
Excellent. Thank you.
Thanks very much. Anything else that anybody wants to raise at this point? There is a recommendation within this paper to ask to note the report and to approve the recommendations related to governance and assurance issues. That's 5.2 and 5.3. Don't know whether anybody's got any issues with us approving those recommendations.
No, it's fine.
Okay, that's fine. Okay, so those are approved, and we note those. Thank you very much. And if there's nothing else on that, we will move on to the next bit, and that's for you, Michelle, and your report. Thank you.
Thanks, everyone. Can you hear me okay? Let me start with an apology. You might remember last time we talked quite a bit about risk and those risks that come to governing body. We spent some time with Abby Coombs and with Julie Hastings as chair of QPEC to review those and put quite a lot of work into them. And hopefully you'll see when Abby gets to do the risk report of those that bubble through to governing body, the work that we've done on that. What seems to have happened is that the risks that come to QPEC that are part of this QPEC report, which would give you assurance as governing body as to what's happening, aren't in this report. And I didn't notice that till last night, but I will do a verbal report on that to you just now, because those are the things that are worrying us, but for some reason are not been taken out of this report. I can always circulate it afterwards to you, but I think it wouldn't be right some information about those risks that QPEC sit with. So just a few things really, assuming that you've read the report, as Nigel says. Outbreaks in care homes are increasing, mainly because of the increase in community transmission of COVID. I think we've got at the minute 4 care homes in the City of York boundary and a significant number in the North Yorkshire boundary in the 60s, where we did have a flattening of that in the previous months. So not unexpected really, and my team worked really close with the local authority to act really quickly on outbreaks. And the contributory factors framework that we talked about last time is really proving popular and helpful to quickly get to the root cause of some of the issues, which are in the main what happens with staff outside of work, sharing of cars, that sort of thing. So hopefully lockdown will help some of that as well. And some IPC practice, although it's so much better than it was. And that framework's been taken up by Bradford and Sheffield CCG as well. So it's doing well, and we're happy to share some of that. There is new guidance just out on the 31st of December about vaccination in care homes. Previously to that, between Christmas and New Year, when people were getting going with vaccination, and Steph and I will touch on that later on the agenda, there was pretty clear guidance that if you had active COVID, you couldn't get the vaccine, and if there was an outbreak in a home, you couldn't go in. So there was a lot of plans that were had to put in place really quickly to change the venues of those vaccinations if homes did have an outbreak. But the guidance now suggests that a risk assessment is a better place to do that, and to vaccinate those who can be vaccinated where possible in those homes. That's been shared with primary care and will be put into action. And the guidance around whether you can have a vaccination if you've got COVID, what it says is if you're asymptomatic, you can't have it within 4 weeks of having your positive swab. And if you've got symptoms, it's 4 weeks since your symptoms started. So it does preclude some people and makes it a little bit more difficult to manage within a care home in terms of how primary care respond to vaccination. In terms of flu, just a couple of messages, as you know, opened up to the 50 to 64-year-olds. Certainly through the mass vaccination site at Askham Bar, the uptake has not been as expected. People aren't really sure why that is, and we're just keeping a close eye on that. There are people coming through, but not as many have been invited. So we shall see, and I'm not sure what the feedback is from primary care about that, if they're getting anybody through. So it'd be good to understand if that's also your experience. The 2-year-olds is another little blip. So the uptake hasn't been as good in 2-year-olds, although that's improving. And in the report, you'll see that for social care staff working in care homes, it was about 50%, but that's greatly improved as well to nearly 60 odd since the report was out. Some good news on mental health. That the CCG has been successful in securing some winter monies to commission dementia care coordinator for the City of York, which is a new post started in December. So that's really, really good and gives some parity with what's happening in the Vale as well. So it'll be good to hear about progress as we go through the launch of that role. It mentions in section 5 there on page 10 about ongoing outbreaks at Scarborough and York. What is the significant bit since this report was done for QPEC is that there has been a significant outbreak on the York site affecting 5 wards with a number of deaths that are likely to be associated with that outbreak. It's been declared a serious incident, and I'll report back here the findings of that. It would be too premature to make some assumptions about the cause of that outbreak, but we're working really closely with the trust on that. Just bear with me as I go through the report. Some really good news from comms and engagement. Victoria's on the call. I saw her face too. That the CCG has been recognised as doing some really great work in terms of involving patients and the public, and got a Green Star rating from NHS England, which is not an easy thing to do. And it's been quite the process to go through. So, really well done, Vicky and her team on that, and all the people in York that help us by giving us really good positive feedback, and feedback that we can use to make improvements. So if I go through the bits that are missing, so that is the risks that concerned us at QPEC and that we actively monitor from a risk point of view. So very briefly, the Children's Services transformation within York Hospital is making really significant progress in that a contract variation is now in place with no extra resource given to the hospital for that, which they're happy with after lots of work with the new team. The risk hasn't changed yet because we've only just got that in place. So we're hoping that once that contract gets going and people start to transform the way that they work, that the risk that was described goes down. Discharges from York Hospital, we remain concerned about some of the discharges, and I believe it's due to the speed of the requirement to discharge people under the new national guidance. Although we're not necessarily meeting the standard of the speed of the discharges required, because of the complexity of flow at the moment and the pressures that everybody's under, there are sometimes issues with the quality of that discharge not being as optimal. But I'm not seeing an increase in issues, even though we're increasing a number of discharges compared to last time. So we're keeping an eye on that. We did have a risk around the infection control practices at York Hospital and agreed at QPEC that we would change that risk to one of the risk of nosocomial infection, so in-hospital transmission of infection, and describe it in that way, which is what we will work on, and you'll see that next time, because that is a significant issue and will be, I'm sure, related to the outbreaks that we've seen at York. Lake and Orchard Care Home that we talked significantly about in the past, the review is ongoing with that, and the learning from that review, once completed, will come to governing body, and we'll share the learning from that. So that's the progress there. Pertussis, where you might remember that baby Theo unfortunately died from whooping cough, and we had a risk that it might happen to other women. The lovely news is that Theo's mum's gone on to have another baby recently, and all is well. And the Humber Coast and Vale midwifery group, which are taking this challenge on, came to speak to the Humber Coast and Vale clinical leaders group, and we raised the issue there about trying to transform the way that people get their whooping cough vaccination, and they are taking that forward, and they're well aware of the issue. And believed that there is probably more that they could do about that, certainly about lobbying national bodies for the change in the guidance, which would allow non-registered midwives, so midwifery health workers, to give the vaccine, which currently they're not allowed to do. So that's where we are with that. In terms of the Healthy Child programme for North Yorkshire County Council, we did indeed send the consultation round after governing body, and we have done a North Yorkshire and York CCG response to that, which I'm happy to share with governing bodies should you want to see that. That just went in, I think, last week. And North Yorkshire took the lead on that, but we inputted significantly to it. And I hope that those on the governing body in primary care had a chance to respond directly to that consultation too. And the last thing from me, progress around the SEND inspection, where we got a written statement of action. Progress is good. The team that visit us from Ofsted and DFE are pleased with the progress so far, which is pretty full on. And we have appointed an associate designated clinical officer and a business support in the CCG to support that significant amount of work. So that's all I wanted to say. Happy to take any questions.
Great, thank you very much, Michelle. Anybody got any questions or clarifications that for Michelle? Michelle, Helena, did you want to come in?
Yeah, I just with regard to your care home visit aid memoir, is that going to be shared with GPs, Michelle? Because I think that's one of the gaps, isn't it, that's kind of come to the fore. The sentence about what are the sounds and sights that you see. I think, you know, we've talked a little bit privately about very quiet care homes where you're not hearing residents at all, and the worries that might invoke and so on. Is that going to be shared?
Yeah, it definitely is. So the version that you see is obviously the version that went to QPEC, but further work's been happened since then, some of the feedback from QPEC just to strengthen it from a safeguarding perspective. And then, yes, Sarah is busy on with sending it out to people, but wants to do it with a conversation with practice nurses and with clinical leads for the homes. So yes, it will be absolutely coming your way. And it's a live document, so if people want to make changes to it and add to it, I'm more than happy to do that.
I'm just wondering whether it might be a good idea to organise a clinical leads for care homes event, because we've all learned a lot and there might be some stuff we can share, but just some of the things that you've pulled together as things that you've noticed and sorts of feedback. It might be helpful for us all to just have half an hour where we hear that rather than it coming into practices more to clinical leads directly themselves.
Yeah, I would completely support that. And Steph and I have been talking about the strengthening the quality aspects of the enhanced contract that you guys have got as clinical leads with care homes, and what does that mean? And so if we could get some standardisation and a conversation going around that, that will really help us sort of nail that contractual requirement, which will allow the CCG to monitor how that's going and give you support where we need to. So I would welcome that. I'm sure Steph would too, because that's a little bit of the jigsaw we haven't quite got sorted yet. We'll get that organised.
Right, thank you. And there's a really good bit around the green rating about engagement communications. Julie, I don't know whether you wanted to come in on that with your roles.
Yeah, I was just actually responding to the message. Yeah. Victoria and I had a conversation just prior to Christmas, and what we're going to do is pull a little message together, which I will send out. So it's for me, it's absolutely wonderful. Amidst all of this, the comms team have done an absolutely amazing job and got us that really, really valuable information in, and encourage people to work with us. It sort of links into everything that we believe in. So we'll send out a really powerful, positive message. We need people to work with us. That's how we evolve, and that's how we make the right decision for people.
Yeah, absolutely. Great. Thank you. And thanks very much, Michelle, for the report. And I take from what we've heard and what you've talked about, we are assured that all the steps are being taken to look at the quality and risks around all the services that we commission. So thank you very much for that. Okay, so if nobody's got anything else to ask Michelle, we'll move on in the next bit of the agenda. And that's for Abby to come and talk about the risk register. Over to you, Abby.
Thanks, Chair. I think I'll just deal with anything by exception because I'm conscious that you've got time pressures today. Just to say we've gone through, so the risks that you've got listed there are all the risks that governing body hold. We had a very helpful conversation, Julie, Michelle, Paula and I, about those risks and the wording of them coming through to governing body. And I think that generated quite a lot of conversation. So they are updated very recently, really, in terms of getting those to governing body. So unless there's any specific questions, I know Michelle's on, so Michelle will be able to answer any specific questions about those risks, but otherwise I'll just leave those with you. And see whether there's any specific issues that you wanted to raise. There's also a recommendation within that report that some of those risks either be moved down to QPEC. So QN08 should be reviewed by governing body within 6 months, but oversight of that risk delegated to Quality and Patient Experience Committee. QN04 be delegated to Quality and Patient Experience Committee, and a request to archive risk QN15. So unless there's any particular issues with that, I'll take that as given.
Okay, I'll just ask, has anybody got any issues with anything in that report or those recommendations? If not, then we will take those. Michelle?
I'm hoping, Nigel, that Chris and Helena and Ruth in particular are satisfied that we've done the review of those risks and described the mitigation in a better way than they came last time, which, we welcome that challenge from you. So particularly, the 12-hour trolley wait one as an example, I'd like to know that you're assured of that, because then we're asking it to be managed by QPEC. So it would be good to hear that you support that we've made those improvements to those risks and described them better, and then where they subsequently sit. It would be good to get that endorsed.
Yeah. Julie, did you want to come in?
Yeah, I think for us it was very welcome, because I think sometimes you know what you're trying to say, you just don't relay it as well as possible. So for us to be challenged on what we'd actually put forward helped us to get together and rethink the way that we were looking at things. And it was absolutely valuable on the day, and Abby was wonderful, as was Paula and Michelle. But actually what I found out was, as I stepped away from it, yeah, it's clearer, isn't it? And it falls into place. So for me, it's very much, we are a team, and we learn from each other. So from your perspective, you need to help us to grow with the quality of information that you need, so that we can grow and provide that for you.
Yeah. So absolutely, that it's good to challenge, good to reflect, good to step back, so we know that we're doing the right things. So I don't know whether Helena, Chris, or Ruth, if you've got anything else to add at this point.
I think the fact that we're quiet suggests that we're probably an awful lot more satisfied with what we see.
Fine.
Sorry, Michelle, we're terrible at negative feedback and forgetting the positive feedback. I think the other thing is that we're probably, and I'm sure every clinician on the call will say this too, that it's really hard to hear the risks are being managed, knowing full well that the picture is awful, and particularly the risks around waiting lists and things about cancer. It's very hard to sort of say, oh yes, we're satisfied that everything's been done, because it just feels like no matter how much we do, we will never get to a satisfactory position. I wanted to raise a bit of a concern that I think cancer patients in particular, the communication is really, really hard for them, attending appointments in isolation without relatives present, or doing remote consulting for breaking bad news or updates on news. We're experiencing a lot of denial and a lot of miscommunication, not because the clinicians are miscommunicating, but because you cannot rely on audio or a person alone to absorb the information that they're hearing. And that's how I'm experiencing that every day in primary care. And Nigel, you're nodding. I'm assuming you've experienced the same. So I don't know if there is anything that we can do to suggest changes, because I know that the oncology department and all of the departments involved in cancer care are really trying and communicating to the best of their ability. But it's not, there's something about this lone consulting and remote consulting for cancer care and breaking of bad news that just is not working very well for patients. I don't know if anyone else has got thoughts on that.
Yeah, Ruth, did you want to come in?
Yeah, I just wanted, just while we were on the cancer thing, just to raise, I suppose it's a positive and a negative from my PCN's perspective, but I've come across a few quite vulnerable elderly people who are being referred on cancer pathways, who because of where they live and because they're vulnerable, they can't go to York or Malton for a COVID test prior to an endoscopy, and so their default is, I don't want it, and they refuse it, and then it comes back to us. And I suppose the positive is I've left it with my frailty care coordination team, who we've now got in place, who've been able to pick that up and spend probably hours on the phone trying to resolve these issues. But I just have that fear that there are people that may be being lost a little bit. And I think it's both the hospital and primary care need to be discussing these people and alternative ways to get them in for their really important cancer tests through. So I just wanted to raise that because I've seen it more than once, and it's just a concern because it just seems like too many barriers for that elderly person to have to jump through to get to that test, and sometimes they just say no.
Yeah.
Yeah, you could use your 40 subs a week to do it if it made more sense for the patient to come to the practice or get it done.
I think that would be quite sensible. I don't know what the other clinicians think, but I think it would be sensible because I do think it is just too much of a barrier for some people.
Yeah.
Yeah, I think the risks are well articulated in the report, improved each time they come. I think the risk reporting is better. Like the others, quite, happy is the wrong word, but content that the risks are being managed, but the risks are escalating, so they're going to change each week. So I'm happy for them to go back to QPEC. On the kind of cancer and hospital front, we've just heard from Michelle about an outbreak of COVID on 5 wards at the hospital, and there's a definite, we could use our green flag rating for communication about communicating that York Hospital is a safe place, but we have to do something about this type of thing to manage that risk. I hear a lot of patients don't want to go. They're worried about the risks of going there. They're not worried about the risks of going to see their friend around their house for a few days or whatever, but they're worried about going to a hospital, whereas actually the environment should be much better controlled. So I think a bit of communication helpful from us about it's safe to go to York Hospital for your cancer tests, and helping ensure that we are satisfied that it is safe to go there as well when we hear about outbreaks. So that kind of communication thing for patients, I think, would be helpful.
Okay.
Great. Okay. Thanks very much. And thanks for your comments. I think, Chris, you might have got yourself a job to front a communications around that. So
can you give them time to have a shave first? Is that?
Okay. Brilliant. Thank you very much. And thanks, Abby, for that report. And then we'll get straight on to you again for the discussion or update about the board assurance framework. Is that right?
Yeah, thank you, Chair. I've noticed when I was going through the papers for today's meeting that there was an action on the action log to include a strategic objective related to population health, and I'd completely missed that. So my apologies that that's not gone on this time. I'll make sure that is on next time. And I'll liaise with Peter Roderick to try and find the right wording for that, and then what sorts of things should be included within that. So apologies that that's not gone on this time. So board assurance framework, last time we brought it, you asked for that to be sent round with the normal papers, accepting that meant any sort of very recent updates will be given verbally at the governing body. I think the most sort of significant updates that might need to come verbally as we move through will be related to primary care and the pressures that primary care are under, particularly when we have a full understanding of the rates of vaccine rollout and the workforce pressures that that's going to put on primary care over and above what are already there. I don't know, Steph, whether there's anything that you particularly want to update on today, or whether you're comfortable that what we've got at the moment is sort of up to date as it can be. But as far as I'm aware, the rest of the board assurance framework should provide you with some assurance about what's taking up the most amount of time for directors in relation to the strategic objectives that they've got at this stage.
Yes, thank you very much. Anybody want to come in about the board assurance framework, or how it looks, how it's developing? I think it's going really well. That it looks better and helpful format.
Chair, I agree. I think it improves with every iteration. I'm really pleased, given all the other pressures that people are under, that it gets better each time we see it.
Yeah, great. Thanks, Phil. Okay. Brilliant. Okay. Thanks very much, Abby. I don't know whether there was anything that we had to say or approve on that. Was there particularly? I just need to have a look.
No, I think you just need to receive the board assurance framework. So when the auditors come and get us, we can say that you've had it.
Okay. Fair enough. Thanks for that. Okay. Brilliant. Okay. So moving on. The next section is to receive some North Yorkshire and New York safeguarding reports, and I think, Michelle, you may be going to introduce this. I don't know whether somebody else may be coming to report or to present for you. I'm not sure. So over to you.
Thank you. So Jackie Horrigan, who's the designated professional for children's safeguarding, is going to come and briefly present the Safeguarding Looked After Children annual report. And the Safeguarding Adults Board annual report for North Yorkshire is the one that's come for information, which I'm happy to take any questions on, but it describes the work of the board at North Yorkshire. And we've got a page where we contribute to that as partners, which you can see, I think it's on page 77 of their report. Let me just find it. So that's really for information, but if there's any questions, I'm happy to take them. And we will, in sequence, get the City of York Safeguarding Adults Board annual report as well, of which I sit on. That's for information. I'm hoping Jackie's here for the next bit. Anybody see her on the thing?
I'll just have a look and see if she's on. Not yet, I don't think. She's not on yet.
Just giving her a text. Yes, okay. So the statement for North Yorkshire Safeguarding Adults Board, is on page 74. I mean, some of it you'll see when we get the City of York one, that we've done a lot of work together on the process and the policy that's multi-agency and now right across North Yorkshire and York. So that's quite a big achievement that we don't have separate procedures anymore. Okay.
Yeah.
If there's no questions on that, I'll see if Jackie's joining us.
Whilst we wait for Jackie, anybody got any questions or anything to comment on that report? Otherwise, we'll just wait a few minutes for Jackie to get on the call.
This next one for Jackie to introduce, what I can introduce is the report from the designated professionals for children that we employ within the CCG, that are hosted by the North Yorkshire CCG. So it's their report, so sort of much more close to us in terms of the staff that we employ and their activities against their strategic plans. Jackie is best placed. Oh, here she is to come.
Hi, Michelle. Hello, everybody.
Hello, Jackie.
Hello. Okay, so
perfect timing. Good.
I've
introduced it, so away you go. You've got 10 minutes.
10 minutes. Okay, I'll skim through. I'm assuming people have read it, but I just want to highlight some particular sections to you all. This is our 8th annual report, and obviously it provides assurance that we actually are doing our job in ensuring that safeguarding children is effectively supported within the CCG. So, as you all know, the past year has provided some significant changes and challenges. Within safeguarding, the City of York Children's Safeguarding Partnership has undergone a complete new restructure. Scrutineer, which is Maggie Atkinson, who was appointed in October time. We also have developed the new overriding legislative framework within the partnership. So we now have the 3 statutory partners, which are the local authority, police, and the CCG. And Michelle sits as that statutory partner within the CCG. Additionally, we've had a restructure within the team itself. So you will know that previously Karen Hedgley was the designated professional for Vale of York CCG. So Karen has retired and returned to post and is working on a job share, Elaine Wiley, over in North Yorkshire. And I have given over my nurse consultant post. That post no longer exists. And I have become the designated professional for safeguarding for Vale of York CCG, so working in conjunction with Karen and Elaine. We now have a named nurse for primary care, Jeanette Griffiths, and we've also appointed a specialist practitioner for primary care, Nikki Heels. They both work across children's and adults, so the structure of the team has slightly changed. But we're working very much collaboratively as we always have done. And I still hold the strategic lead for primary care, so we've still got that strategic management oversight in the desk professional team. Additionally, and I don't need to tell you all, we've had obviously the pandemic at the end of the year, which posed us significant challenges in ensuring that actually we worked in a different way, particularly with regards to things like looked after children, initial health assessments which needed to be conducted remotely or not face-to-face anymore, and that's against legislation. So all that work needed to be undertaken in order that our responsibilities were completed during the COVID pandemic, and is continuing, as you will no doubt appreciate. You will see from the report that with regards to looked after children nationally, we're seeing a steady increase over the past 10 years. Within Vale of York, or City of York, we can see that there has been a significant increase of looked after children. So looked after children accommodated out of area, but that are, and the total number of looked after children by the authority has increased by 20%. Smaller number in North Yorkshire, only 2%, but you can see the increasing amount of looked after children. What we are expecting is with the pandemic, what we're seeing is steady rises in safeguarding and child protection, steady rise in children coming into looked at. So we expect that trajectory to carry on. What we are also seeing is an increased number of young children with physical injuries. So again, that increases the safeguarding children coming into child protection remit and becoming looked after. Particularly this year, we're seeing that with the pandemic and lockdown, and we're
sorry to butt in, but I can't keep losing the sound.
We have had a number of those placed in our area. We're expecting that to increase. And again, they pose pressures on the system because they require significantly more health assessments because of their particular physical and emotional health needs. So we're working closely with our partners to ensure that those particularly vulnerable young people have the services that they require because they are particularly vulnerable. I've just talked about the increasing need of safeguarding services, and on page 8 of the report, which is page 92 of yourselves, you can see at the top of that the numbers that are increasing. Now you can see that in the City of York, they are significantly increased more than North Yorkshire, and that is for a particular reason. We had an appointment of the new director and assistant director of children's services in the city, and a subsequent Ofsted inspection in 2019. And with that, there was a recollaboration of the cases within the city. So every single child that was had a child in need plan or had a child protection plan was looked at, and we had a real increase in numbers of children that required child protection plans. So that recollaboration happened, and that's what we're seeing there with the increase of conferences and child protection plans. What we're seeing now is that plateauing out as things settle, as the system settles. But as I've said previously, we're still seeing a gradual trajectory of increase in children becoming looked after and subject to child protection plans. As part of that improvement journey following the Ofsted inspection, the local authority established an improvement board, which I sit on, to provide external scrutiny and support, and that improvement board continues to be undertaken monthly, and is seeing improvement in the system within the local authority that we support. I'm not going to talk about the CCG statutory functions because I think they're plain to see, and we obviously we provide the correct personnel and the correct skill mix. we sit within the partnership and do some chair some structure of the City of York partnership. So I'm just going to leave that as said, unless anybody's got any questions regarding that aspect. What we have done to support safeguarding across the health economy, you can see there's a few significant things along there. I just want to draw your attention to the development of the MASH, which is the multi-agency safeguarding hub in York. So we led in securing that health resource within that MASH. So we now have a multi-agency safeguarding hub, which with local authority. So essentially the front door, as safeguarding referrals come in, it is now goes to one single point of contact where we've got the local authorities, so social workers, we've got police, and we've got a health practitioner sitting in there that represents health, but also represents the health economy. That is a joint funded post by the Public Health and the CCG, and that post gathers information from the wider health economy, including primary care, which is really significant, because previously we had a real concern that actually primary care wasn't represented in those safeguarding assessments, and it's significant that we really need to ensure that they are. That post also represents primary care in strategy meeting, which again is really, really important. So we continue to work very closely with the local authority and our safeguarding partners to develop that MASH further. It has recently had a front door check, which came out very well. However, there is areas that we need to improve and develop further. So we're working very closely with our partners in the local authority in order to improve it further as things develop. One of the other really significant developments which I want to draw your attention to is the icon. Really important when I go back to thinking about how we are seeing an increase in injuries to young babies. ICON is a public health message, really, which was initially implemented across North Yorkshire and York and launched in November 2019. It's now been implemented across the northern region, and it's to support parents in supporting helping them support when babies cry, and understanding that it's normal for babies to cry, and what to do to help and where to get support from. So really significant. That ICON message is now delivered in primary care, it's delivered in midwifery, antenatally, postnatally, and is followed on through the health visiting service. So it's a really fantastic public health message that we developed working with Suzanne Smith, who is the director who's pushing this nationally. So really, really important, significant development that we've supported within the DES professional team. Needless to say, we work with all the multi-agency guidance, and within the city, with the new partnership, we've undertaken a significant amount of redevelopment of our partnership multi-agency guidance as the restructure and the appointment of the new business managers, Sophia Lenton Brook. So we've done a lot of work within the city and Vale of York and that. And we can see we've developed practice guidance on safeguarding unborn babies, fabricated and induced illness, and again re-looked at the managing of injuries to non-mobile children. You can see that's a theme. I keep talking about this, injuries to non-mobile children. We really are looking at that very closely and to see what else we can do. We'll be continuing to do that this following year. COVID is huge. I'm not going to talk about all the things we've done. We've done a huge amount of work to support COVID across the system. One thing I would say, it has really, really developed our partnership arrangements with our local authority and our police. We have we did have weekly calls during the pandemic, the initial pandemic. We now have them fortnightly to look together at how we can support the system. I've talked about the new partnership arrangements. I won't talk about inspections because I know that we're short of time, and reviews, you can see them there for yourselves, the first three. the City of York partnership reviews, and the next are the North Yorkshire ones that we support within the safeguarding. So moving forward, our plans for this coming year is pandemic to support this lockdown, to continue to ensure that actually our safeguarding is supported throughout the system. Simple things like we're just looking at ensuring safeguarding messages and domestic abuse messages are displayed in our vaccination sites. It's something I've been working on today, because we know domestic abuse increases during lockdown, and it's very hidden because people can't be going out. So we need to ensure that those messages are spread for our practitioners, but also for our communities. We will continue with our audit programme, continuing with supporting safeguard arrangements within the City of York, significantly working with our ICS over in Hum and Coast and Vale as our the progress towards that development, and strengthening our children in care arrangements. Any questions for myself? I know I've skipped through that, but I know I was very short of time.
Great. Thank you very much, Jackie. I'll just
any questions from anybody?
Yeah, open it up. Ruth, did you want to come in?
Yeah, it was just tying in sort of your safeguarding work with the changes to the Healthy Child programme in North Yorkshire, because I have a lot of concerns about our few remaining health visitors are just taken up solely with safeguarding, and the risks that then gives, because they're not having those relationships with these families, the same sort of relationships with the young families, and the risk that brings. I just wondered, what have you guys been feeding into the consultation, and do you have concerns as well?
We do have concerns as well. Return to the consultation. We've highlighted it to Michelle and Sue Peckett. We are fully cited on it, Ruth, and we do share your concerns with that.
And they have been put into the consultation too. They've been absolutely part of the words that went back to North Yorkshire as part of the consultation.
Yeah, we have. Yeah, we've had lots of conversations about it, Ruth. Completely. Sorry, I'm breaking up a little bit. Apologies.
I think the premise of the new model is that safeguarding will not be forgotten. That is their highest priority. But practically, if you don't know these families because you've cut back on some of the services, it automatically, we believe, makes that much more difficult. So we are really concerned about that. And what the health visitors tell me is that they don't, their time is completely taken up with safeguarding now, and they don't have time to do the other things. So, when you don't have time to do the other things, then you don't pick up on problems that are emerging in families.
Yeah. And safeguarding really works on the premises. Actually, we should do intervention as early as possible, early help, early intervention. We don't want to wait till we actually get to child protection level. So exactly that, Ruth. We need to ensure that we do that early intervention. If we're just doing the higher, we're crisis fighting really. We also have concerns about the 5 to 19 model. Because of course, again, the school nurses, will be very few of them. What will they actually be able to do? And they won't know their schools, they won't know their children, and they won't because of that, they won't be involved in safeguarding either, because actually they have got no involvement in those cases, so they have no reason to be involved in the safeguarding. So we have got significant concerns, and we've shared those widely.
Thanks very much, Jackie. I would just say, Ruth, please also put in a comment from your own practice and any other North Yorkshire County Council practices that are concerned. Please put in a response, because I think that's important that we have that full response.
Yeah, absolutely. We've encouraged everybody to respond.
Yeah. Thanks very much, Jackie. Michelle, anything else that you wanted to add at this point?
No, nothing more from me, just thanks to Jackie.
Yeah, thank you very much, Jackie, for joining
you,
and presenting that.
No problem. Thank you all. Take care. Bye-bye.
Bye.
Thank you, Jackie.
Okay, so we're now moving on to the next bit, which is a financial update, and that's over to Simon. And then the last bit is a COVID update, and Michelle's going to do a verbal update on that. So over to you, Simon.
Thanks, Nigel. So you've received the report for month 8, including a forecast to the year end. Fair to say that the financial arrangements nationally put in place to respond to COVID this year are incredibly complex and change quite rapidly and quite frequently. So although the main approach to finance is quite simple, so every organisation in the NHS is being what's called trued up to break even. So everybody will break even this year. The arrangements under that are quite complicated and quite tricky to keep on top of. So the improvements we've made in the processes and controls we've got in the department over the last couple of years have really paid dividends in terms of us being able to respond to the current situation and keep on top of where we are. So again, on the face of it, quite simple, we'll be trued up to break even, but underneath that, quite some complexity to keep on top of and manage and make sure we're doing everything in line with the guidance as it emerges. Long and short of it, however, is that at month 8, we are where we'd expect to be on plan, and our forecast is to break even, which is the plan that the governing body approved earlier this year. So probably don't want to say any more than that, Nigel, at this stage, but happy to take any questions.
Thanks very much, Simon. An odd year all around, really, for everything. Anybody got any questions or anything that they would like to raise on that? Helena?
Apologies, because this might reflect my ignorance, but given the financial position and obviously some of the emerging priorities which would not have been known at the position of negotiating a budget a year ago, what scope is there for flexibility around moving funding to areas of priority? So, for example, thinking about child mental health, which we've already had mentioned that there'd be increasing funding into trying to mitigate things like learning disabilities, things like dementia services, the populations that we know are going to really suffer from the pandemic, and then other issues that we've talked about like cancer care and so on. What flexibility is there, Simon, and what control have we got about how we move funding towards what are now even bigger priorities than they were 12 months ago?
So I guess the first thing to say is that we don't negotiate a budget. We're allocated a budget, and the expectation is we live within it. Now, within that budget, there will be pre-committed spending. So the cost of organisations that are already there, the cost of services that are already there. And each year the NHS has, even through austerity, been given growth funding. But there are usually quite significant national expectations about where that funding will be spent. So, for example, primary care, the additional roles, the mental health investment standard, there are expectations set about acute care in terms of a national tariff. So the short answer is, I guess, by virtue of the fact that we are a national health service with a nationally determined budget and national priorities, our ability to locally influence that is necessarily limited. But the governing body's been quite clear as to what our priorities are, and each year we've been able to find ways, sometimes recurrently, sometimes non-recurrently, to support those priorities, as we have even this year, despite all of the complexities. So those were picked up in Phil's report earlier.
Chris, did you want to come in?
Yeah, we heard from Michelle earlier about potential risk with discharges, and then in your report, Simon, there's one of the emerging risks there was about sorry, I've just lost the exact wording, but a discharge plan. What's it called? It's something I've not heard of. This is why I don't know the name of it.
The hospital discharge program.
Hospital discharge program. Yeah, can you tell us what that is and why that is a risk? It seemed like it made up most of the overspend.
Yeah, so as well as being so the first half of the year operated pretty much as a spend what you need to spend approach, still with control, still with external scrutiny, but that changed in the second half of the year to a fixed budget. On top of all of those arrangements, there were specific streams of funding put in place for significantly the hospital discharge program. Now that was a nationally specified program which was meant to accelerate as far as we possibly could people out of hospital by ensuring that the NHS and local authorities work together. It's a nationally available pot of money on top of our allocations, which the CCG and the local authority have been able to use to expedite discharge from hospital. It is, however, reimbursed retrospectively, hence there's a lag in terms of when we get that because there's external scrutiny on the spend that's been incurred. We meet on this routinely with the council, so once a week we have a finance group where we meet to look at what we're collectively doing to support that, and again a weekly meeting around the operational aspects of that programme. It changed halfway through the year. So the first half of the year, people discharged from hospital did not have to contribute to their package of care, where otherwise they may have under the normal operations of social care. And there was no expectation of CHC assessment. In the second half of the year, that changed. There is now an expectation of CHC assessment, and all placements are funded centrally for only 6 weeks. And in that period, we're expected to have undertaken both local authority and CHC assessments as would be required. So again, for people discharged on the first half of the year's scheme, we've got a trajectory that's being nationally monitored about how we exit them from the scheme appropriately, and that will include them potentially, some people at least, having to pick up the costs of those packages of care where they would be assessed as needing to.
Okay, that's helpful. Thank you. So the I got the figure from 2.2 million. We're expecting that back, are we?
Yeah.
Over and above the allocation.
That's right. So, and we can have, a couple of months ago, I reported that there was, we had yet to see reimbursement for the first 6 months of the year. So I was starting to just flag that to governing body. We've subsequently had that reimbursed. And so I think, given that our systems and processes of control have now been through an external validation, we could have an increased level of confidence that that £2 million would be reimbursed. It is worth noting, however, that that's still a fixed pot of money nationally. So it's been negotiated with the Treasury, but it is a fixed sum. So it will be monitored on a monthly basis at a national level. I couldn't say from our local perspective what the national position is, but clearly we're using that funding as flexibly as we can to make sure that discharge is working as well as it can. So we're not worrying too much about the fixed nature of the national pot, whilst at the same time maintaining appropriate controls and balancing that with as prompt a discharge set of arrangements as we can get.
Makes sense. Thank you.
Thank you, Simon. Thanks, Chris. Anybody else want to comment or ask Simon for any clarifications? No. Thanks very much, Simon, for that.
Thank you.
So the last bit of our agenda, we've got about 15 minutes on this, is verbal update on a very fast-moving COVID update on in the area. So this is over to Michelle to lead on this bit.
Hello, and I'm sure that Steph will do a bit of a double act. It seems some days that we do nothing but COVID vaccination at the moment, and I'm sure it's the same in practices too. So I'll just give you a brief overview of what's going on. The situation in terms of COVID infection within York is very significantly increased. The rate is the highest in the Yorkshire and Humber at 529 per 100,000 due to the new variant and sustained community transmission. So it's a very serious situation, and certainly public health colleagues and others welcome the lockdown measures, which should help with that. And what we're seeing is pressure on all bits of the system because of that. People are poorly, younger people are poorly, ICUs are getting full. You'll have seen a lot of this in the national and local press. And although there is some capacity, certainly we're not feeling the ICU issue within York, within Humber, Coast and Vale, they certainly are struggling, and particularly around the whole area. And workforce is significantly affected by either isolating or being off sick themselves with COVID infection. So it's a very serious situation, and York Hospital situation in terms of the numbers of people that they've got with COVID infection is now surpassed what it was in the first wave, with nearly 150 people in hospital with the infection. So that's more than it was before. Vaccination absolutely crucial in the fight against this. And as you will know, the Pfizer vaccine came out first. It's a very unstable, if you like, vaccine in terms of it needs lots of care and nurturing to be able to give it effectively. It now can be moved, so that allowed us to start doing care homes before Christmas. It still can only be moved twice, once to the designated site and then once out to care homes. So that makes it logistically a little bit more difficult. It was approved that you could now get 6 doses out of the 5-dose vial. And people have been instructed that they can do that, and in some cases they can get more than that out of it. You just need to be careful that obviously when we get to a point where we give second doses to people, that is something that people can do on a regular basis. So you don't want to push how many you get out of the vial, because you then might not get the same number of doses available next time you get a supply. And for Pfizer vaccine, the 15-minute observation is still in, although there's been some relaxing of those who are susceptible to anaphylaxis through food allergies, who are now allowed the Pfizer vaccine. So it's just those that were allergic to the contents of vaccine that can't have it, that carry an EpiPen. And there's also been some relaxation on pregnant women who can now also have the vaccine. So that is fast moving in terms of, primary care will have made plans which will have excluded some people, and now they're in that cohort. Second doses, as you know, national policy to move away from the second dose of the Pfizer vaccine within 21 days to allow people to have it within the 12th week. That has, although people accept the moral argument to vaccinate as many people as possible with the first dose, and backed up with some science about what immunity that gives you, logistically, that's been very difficult, and primary care have had to cancel and are in the process of rebooking thousands of people because of it. And because of the way that the vaccine supply flowed, some people will have had in the early days a second dose, but the majority won't get that until later on now. And then a couple of days ago, the Austrozenica Oxford vaccine is approved, much more stable. You can get 8 doses out of it. Has to be kept between 2 and 8, but much more like how you would manage flu vaccines. You get 8 doses out of the vial, and once you've opened it, you've got 6 hours to give it. So although you would want to use that for smaller care homes and for those that are truly housebound, you've still got those 8 doses to get out of it within a certain time frame. So it's not as straightforward as people would like, but it's much better logistically in terms of better than the Pfizer one. And the PGD came out last night, so that will enable people to give it in a much better way. So we'll push that out if you didn't get it yet. The issues which we live with day to day are the supply issues. we would love to be able to say that it's just coming when people want it. It's not. That's not the case yet. You know, we understand that internationally, it's a really difficult job to get the vaccines out to people, but it doesn't allow primary care to plan very well, and we accept that. It should get better. We keep getting told it will get better. It's a push model at the moment, but hoping in the next week or two that it will go to an ordering model where you'd be able to be much more in control of what you want and when you want it. Consumables has also been an issue. Sometimes we haven't got the stuff that goes with it that would enable it to be administered, such as fridges and cool bags, etc. Sometimes that trips people up, but it is improving. It can only be delivered to designated sites. So particularly in Shire area, that makes that really difficult because the designated site is not near some of those practices in sort of Stillington way. And so there is an inequity at the moment in who's got a vaccine so far. So hopefully the AstraZeneca will make that easier. And I know Pickering are helping make sure that inequity gets dampened down. Although the designated sites there isn't a plan to increase the number of designated sites, you can give the AstraZeneca vaccine out of any establishment if you like. So if you've got village halls that you might use or other venues, that's absolutely fine to do that, and that should make that easier, certainly for that sort of easy mold area and the use of the health centre and wherever else you're thinking of. It just needs some pharmacy sign off to make sure that clinically it's safe to give it in that environment, and our in-house pharmacy team will help you with that. Workforce, I'm sure will be an issue. We keep talking to the PCN vaccine leads who don't say they're desperate for staff at all, but I think it's because they can't yet plan for when that vaccine will come. And more importantly, I think it's the discussion about what doesn't get done within primary care while the vaccine programme is full on and will be for quite a long time. And I know the LMC have written out with a very detailed description of what they believe should continue and be stepped down within primary care, which you'll all have received. Steph and I are investigating workforce offers from the regional team from the Bring Back Staff campaign. We don't quite understand how that will work and what that offer is, so we're meeting with that team in the next few days, and we have a handful of staff that are willing to support you guys, and I'm going to write out what that offer is after discussions with the PCN leads yesterday. Particularly helpful are vaccinators from the Healthy Child programme at City of York Council, who've given us a rota now, if you like, of when their availability would be that people can tap into, a bank type arrangement for other vaccinators. But certainly there was an ask to see if we can find more admin support, either booking patients, rebooking patients, or sitting alongside doing the inputting while the vaccine's been done. So we're putting some feelers out there as well. The mass vaccination site at Askham Bar, which I think it's important to just stress, does two things. So Askham Bar is the local PCN model for PCNs within the city to give the vaccines under the enhanced service contract with primary care, and then the mass vaccination bit of it, which is contracted by the NHSEI and has been approved as of yesterday for mass vaccination, subject to LRF sign-off for security and fire. And I think that will be hugely helpful because, as you know, the cohorts agreed by the JCVI are the over 80s, care homes and care home staff as priority one, and then clinically significantly vulnerable within that too. And then all NHS staff, and that description of NHS staff and social care is massive. In the Green Book, it's absolutely huge. It's thousands and thousands and thousands of staff, and certainly for York, the ideal way to do that is through the MassVac site. What we don't know is what's in the contract yet for that MassVac site, but we all are making assumptions that's somewhere that they could really use that site for. So I'll just pause there on vaccines. Any questions? No. Okay. And then just very briefly, we've had so you will know that the government announced that all over 70s need to have the vaccine by mid-February. That is the kind of cohorts 1 to 4, actually, when we haven't yet done cohort 1. done about 30% of the over 80s across the Vale of York. And we've done about 13, 14 care homes so far. So we've got some way to go. And primary care say over and over and very loudly, give us the vaccine and we'll crack on with it. And we hope that will become easier. And we've also had a discussion with the trust day before yesterday, which Nigel was involved in, and Stuart Calder from an ethical point of view. And then we talked to the PCN vaccine leads yesterday about prioritising vulnerable individuals who are about to have a very big operation at the hospital, such as aortic aneurysm repair, nephrectomy, that sort of thing, and making sure that they get first dose of vaccination, because they may not fall into that first cohort and may not be on your radar. So there was overwhelming support for that yesterday with the PCN leads, and which they would prefer is that the hospital write to the PCNs and say, this person is due their operation in a month's time, can you ensure that they get a vaccine? Obviously that's vaccine supply dependent, but we're really up for trying to manage that cohort of people in a very safe way. So that's good news. So I'll sort that out after governing body in terms of getting back to the hospital and establishing a process for that. And then just very briefly, testing, lots and lots of avenues for people to get tested. And lateral flow testing in particular is being rolled out to primary care and to other venues, and the lateral flow testing sites at St John's and soon at York University are coming online as well. So I wasn't going to say much more about testing. It seems much better to be able to get a test and results come back much more quickly than they did before. And the lateral flow testing is really important because it's a requirement before people go into care homes to make sure that they have been tested before they go in. So I don't know whether staff's got anything to add to that quick roundup of what's going on with COVID. We've already touched on some of the risks of that earlier in the conversation.
No, I was just answering Chris's question about number of care homes, and of course pre-Christmas we were restricted on just going into large homes because we didn't have the guidance on pack down from the big pizza box. So as we get the AstraZeneca, we can go into more of our smaller care homes. So work is moving at pace with care homes. We've had some interest because the Askham bar site this week is receiving 3 porta cabins. People who know about the site, it's been operating out of marquees, but they'll get fixed sided porta cabins, and the MOD have been helping that site get ready for the volumes that they anticipate. Yeah, I don't think there's much more to say on that. Supply's been bumpy, but when you reflect on what they're trying to achieve across the whole of England, it's not surprising.
Okay, Michelle, I just didn't quite catch the thing about prioritising people having operations.
Yeah.
Was that people outside of the JCVI cohorts? Because we need to move through the cohorts, don't we? If we go outside that.
Yeah, it would be a local agreement because we all as a system believe that that's the right thing to do for these people. I think the majority of them will probably fall into that cohort of 1 to 4 of being over 70 at least, but they might not, and that's why they might be outside of that. But if we ask the hospital to give you a good month's notice of when that operation is due, you might well be able to build that into your plans. Again, if they're housebound, you might have covered them. If they're over 70, you might have covered them. But we believe it's about 7 to 10 people a week, the hospital say, distributed between primary care. It shouldn't be large numbers.
Okay. David, did you want to come in? And then Helena?
Yeah, just very briefly, what about antibody testing? Is that now kind of been abandoned, or is that still part of the national strategy?
No, it's all gone away.
Right. Any particular reason? Because it wasn't effective, or?
It was very time limited national strategy. which was set up really quickly. It was slightly delayed because of the way that it needed to be set up. We've gone past that time frame that was required. And we don't know, we're not being asked to set up that service on an ongoing basis.
It's also been shown to be pretty useless. People who've had COVID who then don't have antibodies, and people who have had no symptoms have got it, and then several months later you've not got antibodies again, so it just doesn't add much value.
One of the things that I would, oh sorry Helen, sorry, I interrupted you.
No, I just wanted to say properly thank you to those of you who are working on the COVID vaccine campaign, and to publicly acknowledge the enormous amount of work both within CCG and at the hospital, but particularly within primary care, and particularly the work of the nurses who have worked tirelessly to get all of this very specific details working right, as well as Laura Angus and her team, because their work has literally been 7 days a week over Christmas at a really difficult time of year, many of them with kids at home out of school. And that is an incredible effort to do something that has been really good. There's a lot more to do, but we've made a really good start, and I'm very grateful to those people who have been working so hard on it.
That's lovely to hear. It makes a huge difference, because people really want to be part of this vaccine effort, and it's not been difficult to get them to, you know, work all those really long hours. They want to do it. They feel it's a once in a lifetime opportunity to be part of something like this, but they really appreciate the thanks and feedback. It makes such a difference. What I wanted to just finish on is just a plea really to drive home the message that after that first dose, people still have to comply with the 2 meters of social distancing and all those other measures, and that people do not get a high level of immunity until about 2 to 3 weeks time. And what we're seeing is some people who are testing positive after they've had their first dose of vaccine. And I think that we could do more to drive home that message. Yes, there are national leaflets that we can give out to people afterwards, but I think that, you know, make use of that 15 minutes or that time that you're packing up your stuff to really drive, because I think we could just do a bit more about that messaging, and maybe the comms team could help with some of that too.
Yeah, okay, great. Thank you very much, Michelle, and thank you, Helena, for those comments of thanks. I think that's absolutely right, and I want to thank everybody that's been involved with it, all the responses that we're doing for the pandemic. So we're coming to the end of our meeting this morning, unless anybody's got any other business or anything that they would like to add at this point. No? Okay.
Can I just say, please. I think it is important to acknowledge that primary care can't do everything, and that there is an impact on delivering this vaccination program. And whilst we would really love to, be able to hit all the targets on health checks and all these other targets, your staff can't be in multiple places at multiple times. So it's that recognition really, and again a request that the comms team help us with that as well, because actually we are stretched very thin to deliver this, and we want to do it, but it does put enormous pressure on us. So yeah.
That's absolutely right, and there has been a bit of chat in the chat box around priorities and how we can move on with that. And I know I have a meeting with Steph and her team later on today to talk about that and how we can talk about that and communicate out. The main thing for us to say to the public is that we will protect the vulnerable. We will optimize long-term conditions and hopefully stop any deterioration, because that's what we're there. And then it's about vaccinating, isn't it? And that's what we want to do. So finally, I just wanted to say thank you to everybody on the call for their input today, but mainly to people that might be watching, is to take care of yourselves and to be aware of all the restrictions that are on us at the minute, and the stay-at-home message, because the stay-at-home message will relieve pressure on the NHS, and the NHS is under extreme pressure, and that pressure will increase over the next 2 to 3 weeks. So just want to thank everybody for what they're doing and for the restrictions that they are adhering to. So just want to say again, thanks very much, and thank you to everybody today. And we'll see you again in 2 months' time for the next public meeting.